At the beginning, I would like to thank Dr. Sham. Sham is a good friend. I have known him for the last 20 years, and then I can see how he is developing his own idea in the form of idea clinics. For today's session, what I thought we will do is that I have about 2 or 3 slides to get the discussion started, because I think it is quite important going forwards how we can shift the focus from treatment to prevention. I think is important both for medical reasons, for ethical reasons, for moral reasons, and most importantly, for financial reasons as well. Prevention is far, far cheaper than treatment. Next slide, please. So how we wanted to plan today is I just wanted to ask individual panel members their opinion on how to prevent or how to create a platform or create an environment where prevention is as important as the treatments which we are doing. Next slide, please. So what are we at the moment in? We are in reactive, expensive, repairing and replacing organs is the time I call today. That is, I am a clinician. I am a cardiac surgeon. In the morning, I go and then do bypass surgeries. But that is the end result. This is, I call this as an acute treatment. That is not what this today's discussion is about. It is about how we can prevent a patient from coming to my operating table. That is the discussion. And at the same time, how to make it affordable. Because I will tell you, patients will come to the hospital and be willing to pay few lakh rupees for bypass surgery. But take their story back 10 years and tell them, get a 20,000 rupees test, they will not get it done. And that is the truth about today. And that is where we need to make some changes is what I think. Next slide, please. The other aspect is India is going to become a big economy, no doubt about that. But if you see the top 10 hospitals in the world, we don't come there yet. Our clinical load is huge. Our variety is huge. In the West, I have worked in the UK for 13 years. I can tell you 25% of the workforce in the UK is Indian doctors. I'm sure the same is the case for the US as well. So we don't have dearth of clinicians and specialists at the world level, but we don't have institutes at the world level. And I think that is another aspect which I wanted to raise. The next slide, please. And how do we integrate? How can we use integration of data, of information, of newer technologies, of preventive models across the country? So this is the reason why I think integration of the existing data, of the existing expertise is also equally important in, again, my first statement about preventing of diseases in our country today. Next slide, please. So from sick care to well-being care, and how can India shift from reactive treatment to proactive prevention? So with this, just the next 3 slides, sir. Next slide. So first question to the panel. How can India shift from hospital care to prevention? Again, mind you, this is a wide variety, and Sham has done an excellent job in choosing people from different walks of life with very, very different backgrounds to answer the same question, how do we prevent diseases? So how can we use technology instead of hospitals to improve care? And then next slide, please. How can we cannot replace hospitals. That's not the point here. But while we focus on prevention, how can we make our hospitals into world-famous institutes? So this is a slightly a side question, but the main question still to the panel is how do we improve our preventive strategies? I don't want that patient to come to my table at all. So, but I have to catch him 10 years earlier and then make sure that his blocks are kept at 10% or identified much early and treated so that he doesn't end up having a bypass surgery. So next slide, please. Next slide, please. So what reforms and partnerships are needed to make prevention a reality? Next slide, please. And how do we integrate? There are so many players who are involved in providing health care, providing preventive care, providing medical care to the patient. So how do we integrate all these for finally the common man to benefit? Next slide, please. So that's my background to the panel. So I would request Dr. Vinay Nandukuri, sir, to first give an opinion about preventing and how you see from your angle, from a scientist's angle.
Knowledge. We have to actually focus on knowledge generation. In the context of if you are talking about diseases, some of them are actually lifestyle, but there are quite a lot of diseases for which there are bases, genetic basis. And wherever there is a genetic basis, such as an example would be sickle cell anemia, where there is a single mutation in your genome, and that single mutation, like somebody, father has single mutation, mother has single mutation, when ultimately when the marriage happens, and 1 in 4 chance that the child will have sickle cell anemia. So those kind of things can easily be identified well in advance. There are many other small mutations here and there which are known to make you disposable, are at risk for heart disease, at risk for breast cancer, at risk for many of the other things. So this particular knowledge is likely to be different for Western world from that of Indian people. So, but whatever most of the knowledge that we have at this point of time comes from whatever kind of surveillance mechanisms or surveillance things that have been done in the West, not as much in India. So we should be looking at our population. We should be focusing on acquiring knowledge with respect to what conditions they have and what their genomes are, what their epigenomes are, which are modifications of the genomes, and maybe transcriptomes, and like basically generate a map where we actually integrate the conditions people have with their genetic material and how the genetic material eventually manifests in the context of expression of proteins and other things. If we can generate some kind of an atlas of this, that may help us actually in...
Thank you, Hemant. So I think the first question, I think it's not very difficult. So I think everyone knows that good health is a great asset, not only for the individual, but for the society and for the country itself. So everyone should know that, and everyone knows. And they shouldn't confuse cure with good health. Cure is damaged body repair. So good health, there are 3 important prevention, there are 3 important players in it: the public themselves, the healthcare professionals, and the policymakers. And the least important among them are the healthcare professionals. As long as the people realize that their health is in their own hands, not in the hands of doctors or policymakers, it's easy to focus on prevention. My own practice, when I see 80% of the problems that I treat are preventable problems. They're all related to obesity and lifestyle. It's the same advice we keep giving them to again and again, to reduce their BMI, to change their lifestyle. But you see generations after generations of them, they come, the grandparents to parents to children, they all suffer the same lifestyle problems. They all know exactly what caused them those problems. They are aware, but they don't implement. Somebody who is high BMI, they know the problems they have got because of the high BMI, but would they take care that their children do not get high BMI? Most of them know. We'll keep seeing them again and again. So there are 4 ways the diseases happen. One is genetic, and then your environmental, your lifestyle, and then disease agents. And you can prevent. Prevention can work all of them. On genetic also you can work. You can induce mutations over generations. say, I've been told, my parents, my grandparents, my father, my grandfather, they all had diabetes by the age of 30. They all had heart attacks by the age of 50. So I was determined not to have diabetes, not to have heart attack, heart diseases, and I don't. So you can prevent. You can work on environmental factors. You can work on the disease agents. You can detect early. You can vaccinate. You can work on lifestyle. So prevention, as long as you realize, it is easy. So it is in the hands of the public, and it's mainly in the hands of policymakers. So the policymakers can work at every level. They are the ones who can create environments. They can bring the changes to environment, to disease-modifying agents, safer water, vaccinations, and to lifestyle also. And I would disagree with your earlier statement. Money is not going to bring you good health. US per capita spent on health is $16,000, and their health index is not much better than ours. Europe spends 3 times less, 1/3 of that. Their health index is much higher than US. Israel spends 1/5 of what US spends per person, and their health index is far, far.
My point was about prevention. You throw money at these sirs, yeah, you get prevention. You throw money at us, we get care. So that's the difference I was talking. But very well spoken, and I think you have put the point very clearly. Our health is our issue. If I cannot look after my health, why will the country or the neighbor or the teacher or the scientist look after? So I think that is a very important point. Public, healthcare, policymakers, these are all important. And as you correctly said, there are genetic factors, there are environmental factors, lifestyles and disease agents, and we have to address them ourselves. If I have a problem, I need to ensure that my child and my grandchild don't have them, as you said. So I think very well taken. And disparity, yes, it has to be addressed. And I think, as you rightly said, time, and when we become a big economic power, everything else will come with it. So last.
Hemant, can I make one complimentary comment?
Absolutely.
So, sorry. So he made a beautiful, I think, observation and comment about smoking. Definitely, we all agree that is actually because of policy makers and also a lot of publicity and putting on the boxes that injurious health and other things. I think that is one of the best example we can take that clue from there. Actually, one day my wife and me, we were talking about this. To stop this diabetes and obesity, can we think of basically banning all the sweet shops in India, or put some kind of labels there on the sweet shops or sweet packets, and something we can think of doing something? Because seriously, we can think about that one. I mean, like basically making awareness that sweets are very bad. So that's one thing we can do.
Yeah.
Higher tax or whatever it will.
So the policy is coming. Yeah, so this is interesting. You see, that's why I think Shyam has chosen a different variety of people, because the prevention needs a variety of solutions. Yeah. Can I request Dr. Mohan Shenoy to give his thoughts on this?
I come from a medical background. I am a medical doctor. I don't practice surgery. So I am from the pediatric plus endocrinology background, and I am into the societies as executive committee member. So I, as a society member, as a task force person, I try to implement whatever communication gaps we face, because we are facing a lot of barriers in the community. So for this, I think we should all have our own individual website. So I would like to ask you, show of hand, because all of you are in the mobile or somebody in the back. So how many of you have your own personal website? Dr. Deep Datta sir has. I think very few will be having on the panel personal website. Everybody will have. But I think the first thing and foremost, I think as doctors, we should all have our own individual websites where we can show what we are doing for the society. That is one thing we can do as a doctor, because I think your government may not agree to that, but your public time, whatever you blog, whatever, but not the Facebook or social media I'm talking. Your own website where you can document what are you doing in your own way as a way to communicate with the public. That's one way. That will help technology to move away from hospitals. That is second, because nobody has taken that question, because the same question has been handled. So second question I will take is a tough question. To moving away from hospital does not mean moving away from you. That means they are going towards health. And when they were seriously ill, they will come to you anyway. So you should not make them perpetually patients, because I think person living with diabetes is they call. We don't call diabetic patient nowadays. It's a person living with, there's a lot of stigma with patients. We should work with them. I come from Kerala where transgender health policy is there. We have got Zumba implemented in the school syllabus. We have got lot of student-friendly initiatives being made. All the initiatives, the government is really doing it as a public-private partnership. Because as Kerala is having a good literacy level, we asked them, we have developed the rural health center into community health centers. And we have got family-based health policy. That is what we are trying from Kerala side. I'm in a private center. I work in a rural medical college. As a government person, I will go for government policies also, integration. So we all help each other to grow. So I think the old times, the textbook of Park, which we call, today we are sitting in Park Hotel, textbook of Park is community medicine. So we are all listening to community medicine today in this panel, public health policy. So I think we should all use technology from our mobile, use websites, create awareness through social media, integrate them into government policies, make our family policy also in there, and work-life balance. Because finally, I think we are all running away to each place. We should have a family time, work time, and we should divide them very intelligently and smartly. That will help us in the long way. Thank you very much.
Thank you. Thank you very much.
Hemant, I just want to cover one point which has not been covered at all. We all know that we all take antibiotics, and it is supposed to actually help us cure infections. But we also misuse antibiotics in a big way. So that if we can stop the misuse, which is both an awareness issue as well as even doctors tend to prescribe them, over-prescribe them, and also it is used in other aspects such as animal health and various other aspects, right? So if we can actually look into implementing, a policy is already in place, implementing policies where antibiotics which are always prescribed are judiciously used, we will prevent one serious problem going forward, antibiotic resistance. And that is going to be, antibiotic resistance is going to be one of the biggest things. That's called AMR, antimicrobial resistance. It's going to be one of the biggest problems going forward in 20 years. And that is preventable, and we are not making enough efforts to prevent it. You can walk into any pharmacy and you can buy an antibiotic without any prescription. In fact, your pharmacist will tell you, you should take this. And these kind of things, not only making policies, implementing policies. That's an important.
Thank you, sir. So, Dr. Shenoy, you were talking about individual websites. I think that's a great idea. I don't have one, but I promise you I'll have one soon. But because I think we all have to start using technology, and I agree with you. I mean, I didn't know that Zumba is a part of curriculum in Kerala. Excellent. That's an excellent initiative. So the advantage. Yeah, and work-life balance. I think that is also important for prevention. So can I have the next slide, please? So, final thoughts from my side as a cardiac surgeon. How can I prevent cardiac diseases? I think we need to get the patients young. By young, I mean what I have now moved on to is anybody over the age of 40, if they have even one risk factor, meaning high blood pressure or diabetes or high cholesterol, or they were or are smokers, and more importantly, if they have a family history. So if they have one of these 5 risk factors, whether they had any testing done or not, I actually do a completely opposite methodology. I actually get a CT coronary angiogram if it is not indicated, because that tells me about present problems and potential future issues also, so that I can prevent a heart attack. So that's what I do at my clinical level. But I agree with you, there are many steps before in which prevention can have a bigger role. So in few final thoughts, how to move from real estate, that is hospitals, to data and technology, saving organs and not just replacing them, and condition-based rather than specific-based care, condition-based. So somebody talks about sickle cell anemia, somebody talks about smoking, somebody talks about diabetes. So at a policy level, individually each condition has a different methodology of prevention. So I think somebody at a bigger level will have to say, okay, this amount of money will go towards diabetic prevention, or this prevention for vaccine preparation. That might be one way forward. Healthcare at home. This has to happen. Health has to come to home. Only then the country will be able to afford the increasing costs of treatments. And who should own healthcare in our country? Again, it's a big discussion on its own, just like how a different panelists have different ideas about that same concept of prevention, who should own healthcare. And I think this is a big debate. And insurance, why I said I wanted to put that is because I wanted to make sure we talk about insurance. Insurance gives money for treatments. But if insurance started giving money for prevention, I think more people will have an incentive, so to say. Okay, free mein aa raha hai test, so kara lenge. At least 100 people will get the test, 2 people will know that they are going to have a problem in the future. Maybe that is one methodology of prevention.
Insurance for prevention care means like most of the tests, I thought some tests are at least covered in insurance, right?
Yes, they are. But from a preventive nature.
No, preventive. Suppose I want to go and check it, my blood profile and other things.
Not all insurances give it. Some insurances give it. So what I'm saying is to incentivize, or the government should come with a policy that insurance sector should have at least this much of coverage. So it is in a way it will make them money. If they offer 10, 50, 100 people tests, 10 of them will become insurance patients also.
The insurance payment actually, if you pay the premium, maybe part of the premium is used for preventive tests.
Yeah.
Like, you know,
yes, sir.
that's what some of the companies do it also, I think, but that can be made generalized, that everybody has a preventive assessment done. All those who are going for having insurance, they should have this preventive assessment done, and that takes care of the burden.
Absolutely.
Even now we have below poverty line, we have what is called as Arogyashri scheme. Maybe some amount of expenditure should be earmarked for prevention in that. So that will actually make it better in terms of early identification and also promoting awareness about disease amongst the community.
Absolutely.
I think much more than that, if you compare Americans and Europeans, they don't spend a penny on their care, medicines, for preventive health. The problems, now we are worried about the cost of the molecule, whatever it is. So preventive care, insurance should cover similar to what happens in Western world.
Absolutely.
In Western world, nobody spends from their pocket.
Yeah.
Why should we spend from our pocket?
Agree. So it has to become a financial model. Prevention has to be a part of some financial models so that it is not burdening the end common man. But I still take what they have said. You still have to take priority. You have to take your own health into hand. Thank you. Thank you very much again.